Master in Anatomy and Physiology with Indramani Pandey.
Whoa. Let's talk about fibrocartilage. What's up, guys? In last lecture, we talked about hyaline cartilage. Now, in today's lecture, we're briefly going to talk about fibrocartilage, one of the very important cartilage in human body. So, what we're going to do today is I'm going to introduce fibrocartilage to you. I'll try to label a figure, you know, with you and help you to identify the elements that present in fibrocartilage. We'll try to find some functions related to fibrocartilage, locations where you can find fibrocartilage. And I'll talk about more in detail about fibrocartilage in other slides also. Let's dive into today's topic. So fibrocartilage. When you see this, like the name or name tag anywhere, what are you gonna think? It is a fibro means fiber, and cartilage means, as you know, right? So fiber containing that kind of cartilage is called fibrocartilage. When you think about fiber, you think about tough things, right? So that's what you're gonna get from this name. So that's the first question on this slide. Can you label the figure? Of course, yeah. First of all, before we label the diagram, what you need to understand is what is this? If you find this structure and what it looks like, then you can figure out this one. So this is our backbone, or this is a spinal cord, or vertebral column, right? Spinal cord or vertebral column, whatever you want to say. And this structure is actually coming from here, and actually these small passages are the structure that is zoomed and just trying to like show you the better picture here, right? So that's the idea here. And let's label this diagram. Okay, what do you think? What is these rows are? These rows are actually thick and these are nicely arranged, right? And we didn't see like this type of scenario in the case of hyaline cartilage, but here we have a more like this thick fiber running like parallelly, or like looks like parallelly, but like these are arranged very tightly. So I think these are some kind of fiber. This fiber in this particular case is a collagen fiber, which is a type 1 fiber, type collagen fiber. This is a collagen fiber, okay, but it is a type 1 collagen fiber, okay. And there are rows of thick collagen fibers you're going to see in the case of fibrocartilage. And why, that depends on the function. I'll just come over that in a few moments, okay. So what about this round thing? This is called lacuna, you know that, right? And the stuff inside is called chondrocyte. Okay, this is a chondrocyte, it's a lacuna, and that might be a perichondrium area, right? This might be a perichondrium area because this is the outer layer, right? So I don't want to say that it might be perichondrium, but I'm not sure because the diagram is not as clear as you can see. But perichondrium is basically that the item, that dense irregular connective tissue that surrounds that cartilage. That's the perichondrium. In this particular case, it is not clear, but I want to just say this is the outer part, so I'm going to consider that as a perichondrium. Okay, so that's about it. Okay, so that's about the labeling of the diagram. Okay, the matrix is not clear, which is very dense, so we cannot see actually the elements inside that. But matrix is very tough here, very dense in this particular case. And the location for this, as I mentioned you, it's in the intervertebral disc, in the backbone. So it is intervertebral disc, IVD. So intervertebral disc, you can find that kind of thing. And the spongy cartilage of the knee also constitute this type of cartilage. And in the knee also you find it. So the location is in the intervertebral disc. So intervertebral disc, IVD, and you find this one also in the case of knee, okay. And you also can find this in pubic symphysis, okay, symphysis, in pubic symphysis. The main function of this is to observe compressive suck, okay. It observes, okay, compressive sucks, compressive sucks, okay. So this is the main function Okay, and it is in the vertebral disc because this is a tough type of fibrocartilage, and it when you like carrying a load, heavy tough stuff, this will allow to absorb that, that um, overload, what I'm saying. So that's why the fibrocartilage is important in that vertebral column. So that's about this. From this slide, what you need to know is the general structure of that, and the function and the location. Okay, that's what it is. Let's go to the second slide here. The fibrocartilage disease. Okay, there are different types of disease associated with fibrocartilage. One of the most common is fibrocartilaginous embolism, which is FCE, which is basically most common in dogs and cats. So it might not be common in human beings, but the main idea here is what happens is there will be a blockage in a blood vessel of the spinal cord. How it happens is usually the discs are usually the anatomy. When you look this one, they have a fibrous on outside, right, and gel-like substance inside, and that gel-like substance inside is called nucleus pulposus, and that when that fragment of nucleus pulposus escapes out into the blood vessel of the spinal cord, that will cause obstruction, right? For example, this is the nucleus pulposus, it comes here and it causes that obstruction, and what happens is the area of the spinal cord starts dying, and when you look in the MRI, what you're gonna see is that it's a blockage, and you'll see that the spinal cord is dying, and you can see that through MRI, and you can not fix, but you can just like reduce that effect by doing physical therapies. So that's another way to tackle this problem. So the fibrocartilage can also degenerate. Okay, so degeneration of the intervertebral disc means you are degenerating that cartilage. What you're gonna have is you're gonna lose that proteoglycans, and you're gonna lose that glycosaminoglycans. As you know, glycosaminoglycans are GAG, right? From last lecture, it is a long chain of linear carbohydrate polymers, right? And what about proteoglycans? Proteoglycans constitute two things. The protein means protein, and glycan means this glycosaminoglycan, right? So the core protein might be, multidominal core proteins plus different, one or more chains of these glycosaminoglycans. The main function of proteoglycan is to help in cell migration and adhesion and provide high viscosity. It provides viscosity, and it also causes in cell migration, okay, cell migration and adhesion, okay, adhesion also. And what it also does is it organizes the water molecules. When it organizes that water molecules, the environment around that water molecules, right, gonna be arranged. So that chemical environment gonna be arranged, like negatively and the positively charged molecules gonna be arranged. So that's why that this type of proteoglycan is very important. And in the case of degeneration of intervertebral disc, this basically we're going to lose them, slowly and slowly, and that will cause different problems. Another thing is called disc herniation. What happens is outer portion of the disc will rupture and tear. So if this is a disc, right, due to different types of mechanical stress or other type of stress, what you're causing is that this is gonna, like, the outer portion gonna be like, like this. It's gonna rupture or tears, and what happens is the jelly-like substance gonna come out, which can cause back pain, numbness, tingling or weakness in the arms or legs, those kind of things. And what will happen is when you're trying to like carry a huge load, so you cannot carry because of that problem. You're gonna have that load bearing problem. So you're gonna have pain when you carry those kind of type of items. So that's why fibrocartilage disease is one of the worst disease also. It will give you a hard time. You have to go a long way in your life. So you don't want to mess up these things, because we want to keep these things like normal. Okay, let's have a closer look. When you see this, this is a very, these are the intervertebral disc. In between that, this is a fibrocartilage, right? And what might happen is this is a normal disc which has a normal function. It can bear some load, right? But degenerative disc means like it is like degenerating from outside. You are rupturing, you are tearing that apart, and sometimes the disc might balls out because of that, some stress that causes that disc to move other side. And when that happens, what happens is you might herniate your disc. So herniation is basically you just degenerate, and that fluid came out from that outer coat, and it blocking that those vessels and causing that numbness. And you can have thinning of disc, which might be another problem. If you have a pad which is not like in normal range, it cannot hold that stress. You need a normal thickened pad so that can absorb those shocks. Another thing might happen is called disc degeneration with osteophyte formation. That osteophyte formation is right here, it's going on, right? So this will create a pain, and this will create a very serious problems in normal human beings. So we don't want to mess up these things, because we have to stand upright. We don't want to be a old man in our 30s. You know what I'm saying? So that's why we have to keep these things in our normal range. So as you can look, this is a normal, right? This is normal, this is abnormal. Look, this is already herniated, it's like degenerative. Almost that that cartilage, fibrocartilage, is already disintegrated. And this is a picture where you have the that fluid came out due to the rupture from the disc, and that going there, and it's like blocking that area, and you are herniating that area, which will cause numbness down to the path. You can have pain, you might need to do surgery to fix that. You'll face like a huge different, plenty of problems from this particular case. That's all about today's topic about fibrocartilage. But before I go, I want to give you some take-home message that will help you to understand more about fibrocartilage. As you talk about the fibrocartilage, one of the example is called as I mentioned you, pubic symphysis, right? That pubic symphysis is basically what it does. What we use for this one is called use to estimate the age of the person in the field of forensic anthropology. So what they do is they examine the wear of that pubic symphysis. That pubic symphysis is very important during parturition, a process where you give birth to the baby. What happens is you try to widen that diameter for so that the baby can be delivered easily. You know what I'm saying? So that's why during parturition the pubic symphysis has a great role, and it plays that role very nicely and comfortably. So the take-home message is the pubic symphysis is used in forensic environment, forensic anthropology, and to examine the wear of to examine or to find out the age of that particular person. And this pubic symphysis has a great role in during parturition, delivery of the baby. So that's all about it. Thank you so much for watching. I'll see you in next lecture, and I'm going to cover elastic cartilage in next lecture. Thank you. Take care. Bye bye.
Please subscribe to see more videos regarding anatomy and physiology.